Good morning, everyone. I have straight up 9 o'clock, so I think we'll get started. My name is Amy Meek, and I'm the Early Childhood Director at the Children's Cabinet and Trust Fund, and I have been asked to chair the meeting this morning so Amanda can attend another meeting. She plans to join us a little bit later, so hopefully we will see her in a bit. Debbie sent out a message with the agenda. Hopefully everyone received. At the bottom, she had a special note saying she was leaving the cabinet and her last day was last week. And so unfortunately, we weren't able to tell her goodbye on this meeting, but I did want to say a thank you to Debbie for her service and dedication to the panel the last couple of years. She's going to be missed, but we wish her well on her as she takes on a new opportunity, and hope that she stays connected to the early childhood work that we have going on in Kansas. Just a reminder, we are, of course, meeting on Zoom today, which means we will follow the Kansas Open Meetings Act. All of the materials for the meeting and the links to the YouTube live stream can be reached by visiting the Kansas Children's Cabinet and Trust Fund website. That's kschildrenscabinet.org. And at the top, there's an About little tab. If you select that, you can find the Early Childhood Recommendations panel and then select meetings to reach those materials. There's just a few things that panel members can do to help the meeting run just a little bit more smoothly this morning. First, if you will clearly identify yourself before you begin speaking. And then second, as a general rule, we don't usually use the chat feature since that's not available to YouTube live stream members. So if you need to use the chat, it will go to our hosts, our Zoom hosts, and they could help you if you have any technical issues with the meeting. Third, it's not essential that you use the raise hand feature, but it is helpful if you're wanting to share something, especially in a large group conversations. And then when we take action, as we will here in a few minutes on approving the agenda in the minutes, I'll ask for a show of hands. And so it's helpful that if you raise your hand or give a thumbs up for that, and we can take the final vote. So for today's agenda, we are kind of doing a little bit of a flip from how we normally do things. We are going to start with our work groups, which we normally have at the second half, but we're going to start with our work group breakout sessions. We're combining two groups this morning. So the Quality and Environments group that usually goes over to another Zoom link is going to stay along with the Childcare recruitment and retention on this Zoom. And then the Family Navigation group will go over to another Zoom. At 10 o'clock, we're going to take a break. So if you'll just wrap up your conversations as you get closer to 10 in those breakout sessions, take a break from 10 to 10:10, and then we will plan to come back at 10:10 and do work group reports. We'll just have each work group report out on their conversations or their discussions. And then we're going to be joined by DCF to hear a presentation about the Childcare Development Fund, and then wrap up our meeting and adjourn. Hopefully we will adjourn on time, maybe a little bit early, but so I just want to thank you. I know this is a busy time of year for everyone, both personally, if you have graduations and all that wrap up stuff at school. And then also, I know most of your jobs super busy this time of year. So I just want to thank you for taking the time this morning to be here with us. So we're going to go ahead and approve the agenda unless anyone has any changes. I will accept a motion.
Amy, this is Riva Waiwatis. There was a little typo on the timeline. I didn't know if that was significant enough to need to edit the agenda, but item 8, it says is 11:20.
Okay, we will adjust. We're not going to, I can't see it right now. So Megan, I'll have Megan make note of that.
Okay. And with that edit, I would make a motion to approve the agenda.
Okay. Thanks, Riva. Do I have a second?
This is Natalie McLean. I'll second that.
Thank you. And then if you will give me a thumbs up, or you can use the emoji if you are in favor. Thank you. Looks like majority vote. And then we'll move on to the minutes. Did anyone have any corrections to the April 15th minutes? And if not, I'll accept a motion to approve those.
This is Callie Hoffman. I so move.
Thank you, Callie. Second.
This is Jennifer Adema. I'll second.
Thanks, Jennifer. Yeah, just give me a thumbs up or use that emoji if you're in agreement with approving that. All right, thank you. Majority vote approves that. And with that, we did not have anyone submit to either Debbie or Amanda for the open forum this morning. But I will have someone put the link for the family navigation group in the chat, or you can find that on your email or the calendar invite. You should be able to find that link. And then if I'll just ask that group to come back at 10:10 and join the other groups in this main Zoom. With that, you're dismissed.
Give it just a minute, guys, to get everybody into the room that they are needing to be in. So if you're staying in this room, you are with the Childcare Recruitment and Retention Workgroup or the Quality and Environments Workgroup. And I am Sarah Gardner. I will be the little facilitator of this particular combined work group this morning.
Hey, Sarah, I just want to let you know that I am actually traveling back from Memphis, Tennessee on vacation. So I'm in my car. So I will be on mute and no video.
Well, thank you for joining us, Cornelia. We appreciate it. I hope the trip's been relaxing enough for you to join a work meeting on a Friday morning on your way back.
Well, I was excited to hear Simon's presentation. And so I popped onto this. My husband's listening to an audiobook next to me and I'm listening to this. So
we think you got the better end of the deal, Cornelia. So thanks for joining us.
Actually, yeah.
We appreciate it.
Right, thanks.
That feels like a lot of pressure for me. I have to
Yeah.
make you coming off your vacation.
There you go. You got to bring it now, Simon. There you go.
All right. Well, with that lovely introduction, we'll go ahead and get started. And as Cornelia referenced, we're going to be spending our combined morning today listening to hearing from Simon Workman. I'm going to give a brief introduction from him, but then he's going to do some intro remarks, share a couple slides, I believe, to kind of give an overview. I have just a couple questions that I will kick us off with after his presentation that we've kind of compiled from the different conversations that we have had as the panel working groups the last meeting. But please feel free to drop your questions in the chat as well, and I will work to share those, or if it makes sense in our timing, you can come off mute. You might have a lot of questions. We could probably spend a whole day and a half, 2 days, maybe even a week on this topic. And so we're going to be brief, but hopefully incredibly informative. So with that, I'll stop talking. I'll get into a quick intro. So Simon Workman is a national expert on childcare finance. He's conducted childcare cost studies for cities and states across the US, many of which have been used to support policy development, advocacy, and subsidy rate setting. His work is focused on supporting states and communities to develop a comprehensive approach to financing their prenatal to 5 system, integrating shared principles that address the inequities in the current system and center the needs of children, families, and the early care and education workforce. Aligns very nicely with what we do here in Kansas. He's the co-developer of the Provider Cost of Quality Calculator, a cost estimation tool commissioned for the U.S. Office of Childcare that can estimate the cost of operating a high-quality early learning program in each state, and it has been approved for use for subsidy rate setting. He's not a stranger to Kansas. He's been working with Kansas for a little over a year now, including to develop a Kansas-specific cost model. So with that, I will turn it over to Simon.
Thank you, Sarah. Appreciate that nice introduction, and good to be with you all this morning. So as Sarah said, Simon Workman with the co-founder and principal of P5 Fiscal Strategies. And I kind of want to make sure this is a conversation. I do have a few slides that I'm just going to share and spend a few minutes at the top of the meeting here, just sort of talking about some of the grounding of the cost modeling work and sort of this understanding of, you know, this different approach to setting subsidy rates. And particularly, I know you as a group are very interested in, you know, how quality intersects with this and also how compensation intersects with this. And so sort of some of those remarks, but then otherwise I want to make sure there's definitely plenty of time for you all to ask questions, for Sarah to ask questions, and to sort of, you know, whatever advice and support I can provide to sort of the work you are doing right now, happy to do that over the next hour or so. So let me just see if I can share my screen. Hopefully you see the PowerPoint deck in the right version, right? Do you see the deck without the notes all around?
Yes.
Okay, thank you, Sarah. It's always like I have two screens, so it's always hard to try to figure out. So I just wanted to kind of first sort of do some grounding in terms of terms. And this comes up a lot because, you know, we hear a lot about the conversation of the cost of childcare is too high, right? And sort of my sort of answer to that is the cost of childcare is not high enough. The price of childcare, the amount that parents have to pay, that families have to pay, is too much for them, right? But what that represents is that represents the cost. That is what providers charge, what providers are charging, which is inspired by what the market can bear, right? If you're an early childcare provider, if you set your tuition rates at what it sort of really costs, and no one in your community can afford it, you're going to be empty. And if you're empty or not as close to fully enrolled as you can be, you don't make any money and you're going to close your doors, right? So what families are paying is the price, and the price is not necessarily aligned with what it costs. You know, the reason there's a difference there is providers are actually able to make it work by underpaying their staff is a main one, but also, you know, when you actually start talking to providers, you realize, well, hey, you're making it work because you're in a community building, you're in a church building, you have a sort of sponsor organization that covers some of your costs, right? You're a family childcare provider who's already paid off your mortgage, or you have a spouse who's providing, you know, the majority of the income. And so that price is not reflecting the actual cost of what it takes to run the program. So, you know, then we try and make that distinction between the price being, you know, what families are paying, and the cost being the actual expenses a program incurs to operate, right? And so, you know, this is making sure that you're accounting for any of those in-kind costs that I'm talking about, making sure that you're actually fully staffed. You know, when we do the cost modeling and talk to providers, we often find that, yeah, you know, we would be budgeted for that, but we lost a staff member, we haven't replaced them, and that helps on our budget. Yes, I'm the director and now I'm in the classroom half the time, but hey, it helped us on our budget, right? The actual cost, if you're looking at cost, you'd account for what is the actually cost to be fully staffed, right? And making sure, you know, that you are filling staff vacancies right away, right? You're not working uncompensated overtime. So when we talk about the cost, that is saying, hey, what's it actually cost providers distinct from the price? But then this third category is true cost. And this is where I think, you know, a lot of the work that you are doing right now in Kansas really comes in, because this is the cost is operating in the current system, right? And the current system is a system that is really built on a scarcity mindset. There has not been enough money in the system for decades, right? Families can't afford to pay, subsidy doesn't pay enough, providers basically make it work and provide high quality care in a lot of instances, but on a shoestring budget, right? And sort of really with a lot of burden on themselves. True cost actually sort of accounts for what does it really cost to meet the quality standards, to meet the licensing standards, to meet the additional high quality standards that providers know it takes to have a developmentally appropriate program. And of course, that includes better salaries, adequate benefits to actually recruit and retain the educators that you need, and for family childcare providers to actually have an income, right? And to actually make it a sustainable business model for family childcare providers, to have a staffing pattern that actually meets the needs of children and the educators, right? So there's actually time for planning time. So there's time for, you know, family engagement activities. So the director can focus on the supports they want to provide as a director, right? Not necessarily being in the classroom all the time just to cover for ratios. So, you know, when we talk about the modeling, you have kind of price, that's the tuition rates, that's your market rates. You have cost, which is ask a provider right now, show me your budget, kind of what's it actually cost you on a cost per child accounting for in kind. And then true cost is that better system, right? That we're all working towards to get to a place where you're paying teachers properly, where you're actually building your system and actually costing out what it should cost, not necessarily what it costs as of today. So, you know, the issue we have in the current system, right, is that the majority of the public money comes from CCDF, right? The Childcare Development Fund, CCDBG, Childcare Development Block Grant. You know, this is the way that states, you know, the feds give the money to the states, right? The states then have a lot of power about how they distribute that money out to providers. And historically, it's been done by a market rate survey, right? Kansas, just like every other state, has used a market rate survey. You go and ask, what are the rates you actually charge right now? And then you set the subsidy at some percentile of that. And the idea behind this, right, it's understandable. It's what does childcare cost in the market right now? We're helping families access childcare in that market, and we're going to give you money to go and access it in the market. The problem is the market is broken, right? The market disincentivizes quality, disincentivizes paying teachers anything. So you have this kind of two-tier system where in communities where families can afford it, they sort of move up to higher quality. For communities where you're relying on subsidy, they can't charge high tuition. So what happens? They can't charge high tuition. So then they report to the state their tuition prices, which are low. And then what do they get back from the state? Low subsidy rates, right? It keeps people who have under resources down in under resources. So what the feds did back in 2015-16, when they reauthorized CCDBG, was said that states could set rates instead of on the market rate, but on an alternative methodology, such as a cost estimation model. And so this is the idea of, instead of, if you think back to that prior slide, instead of setting rates based on that blue price, it's set rates based on the yellow cost piece, right? And what this means is you're actually setting rates based on the actual expenses that providers that are incurring. So you can make sure that programs are actually compensated through the subsidy system at what it actually costs to provide care, you know, irrespective of what families in that community can afford to pay. You can also build into that, what does it cost for additional quality activities a provider might do, or special circumstances if you're providing care to children with special needs, if you're providing care to a lot of bilingual children. You can account for the additional costs that a provider might incur to do that, right? If you need additional staffing for that, if you need additional push-in services of a translator or of a English teacher, ESL teacher to come in and help, right? Those things you can build into the cost model in a way that the market price doesn't account for, right? Parents might want that, but if parents can't afford it, right, they're not going to be able to pay that additional tuition to get that. It also allows you to do this. One of the big things about CCDF is you're supposed to be pushing for equitable, equal access is the term they use. So families who rely on the subsidy are supposed to get equal access to care as people who are paying private pay families. Well, that is not entirely true right now, both because states don't necessarily set it at the 75th percentile they're supposed to, but also just because providers often don't take subsidy, right? Because they cannot get as much money from subsidy as they can from private pay tuition. So, in a lot of communities, you see not only are there childcare deserts, but there are childcare subsidy deserts, right? Where if you have a subsidy voucher, can you find a provider that will actually accept that voucher? You can't. And if you can, it's a program that has high turnover of staff and other things that we know are not as developmentally appropriate for young children. So you can use this sort of cost modeling approach to really address a lot of those inequities in the market. And this slide, we show quite a lot because it kind of does show this kind of current reality of the two sides of the market, right? You have private pay families. They're very price sensitive. Yes, in surveys, they say they want quality, but ultimately when it comes down to what's your choice of why you pick childcare, it's about location and convenience, who has a space, right? We know that that's a huge problem, and what you can afford. And families see quality is important, but those other things are structural barriers to accessing, right? That you have to get past before you can get to looking at quality. So price becomes really a sensitive part of that, which is then incentivizing providers to keep tuition rates low. And so, you have this lower demand for quality. If you're a provider that says, I want to pay my staff $25 an hour, I want to have an additional person in the room, you can't find in most communities families who are willing and able to pay that amount. So on the private pay side, you have, a generally discouraging supplier investment in quality. There are pockets of the country, right, where families can afford that, high income areas, and that isn't the case. But in general, that's the private pay market. And then on the subsidy market, you just exacerbate that. All those market failures get embedded by using a market-based approach, right? And in addition to that, most states don't even set their rates at the market rate, right? So you're even lower than that. And so that's why this push for cost estimation modeling has kind of really come through in the last few years. Now, DC did it. The District of Columbia, not the federal government, the District of Columbia did this back in 2017, 2018. They've had a couple of rounds now of using modeling. New Mexico just did this last year, and several states are looking into this right now. And you basically have a couple of options. You can do the full set your rates based on cost. What DC did first, and what a few states are looking at now, is still doing a market rate survey and doing a cost analysis and kind of doing some combination of the two, right? So that you can make sure that you're moving to this approach of paying on cost, but you're also making sure that you're understanding, well, what is the current market looking like, and how are you accounting to make sure that you're not kind of going below that. The reality is there are very few markets around the country that actually exist at the cost. So when you move to movement and cost, it's very unlikely that the rates would go down. I give you an example. In New Mexico, the center-based rates, when they moved to setting based on cost instead of market, went up about 80% for an infant. They went up about 70-80% in the family childcare homes. Because in family childcare homes there was a huge increase, because they went from a tuition rate that didn't really account for any salary or benefits for the family childcare provider to a cost model that actually said, let's put in a salary for the provider. Even if they don't necessarily pay themselves a salary, let's make sure the rate accounts for having some money for them, that they are actually making a real business of this. So I think it'd be interesting to tell you a little bit more about some of the cost estimation modeling, and then how kind of the different sort of quality and compensation pieces fit into this. And then, happy to kind of talk through any questions that you might have from this. Cost estimation modeling, this sort of slide sort of summarizes what it does, right? At its heart, it's a tool. It's a cost calculator, a modeling tool. It's not a budgeting tool, right? It's not meant to capture every single provider in the state, but it's meant to capture the diversity of providers and sort of understanding those costs of operations to inform policy, right? Every single provider is very different. But the model is meant to give you enough data to inform a lot of different scenarios to represent those different types of providers. And so it can be built to tell you, what does it cost to meet basic licensing standards, right? But then also, what about additional quality standards, right? Like if you wanted to talk about, some states tie this very much to a quality rating system, but it doesn't have to be. It can be, about, well, what happens if we do these 3 things above licensing? What would that cost? You can also see the impact of different program sizes or ages of children served. This is a key one, as a lot of states look at universal preschool or expanded preschool, right? Expanded state preschool. What happens if those children are only in the public schools and are not in the private childcare centres? You can show with the cost model what impact that has on the cost of infant toddler care, right? Because programs right now tend to cross-subsidize with, they lose a lot of money on infants. They maybe make a bit of money on preschools or school age or don't lose as much, and they can balance it. It's a lot harder to do that when you lose your older children. The other thing you can do is put that cost up against the revenue, right? So both showing, hey, here's the right mix of if you have subsidy and tuition, or if you get these grants, like what is the gap between costs and revenue? And, I think one of the things people often ask on this is, well, isn't this new model going to make it a lot more expensive to the states? Well, it is, right? And I think there's lots of arguments of why, you should spend more money, public money on this. But one of the things the model can help you do is think about implementation steps and prioritization, right? If you can show where are the biggest gaps right now, if you say, yeah, ultimately we'd love to get to this end goal, but reality is we have this much money to spend next year, you can say, well, let's remediate the biggest gaps first, right? Let's see, is it in infant care? Is it in our rural communities? Is it in our family childcare providers? So you can really make some decisions about where your prioritization will be, informed by the data. So I just wanted to give you a quick thing about the cost drivers. So, this comes up a lot of like, well, what are we actually including in the model? Well, as I'm sure you all know, the biggest expense for childcare providers is personnel, right? It's a labor-intensive business, which is one of the challenges, right? That there's only so much that technology can do to make early childhood sort of more efficient. Yes, there's lots of things on the back end in the back office, but ultimately 60, 70, 80% of the cost of running a program is personnel. So one of the big things we do in the modeling is figure out what are the salaries, what are they now, what should they be, what are the benefits you want to build in, both the sort of mandatory benefits, but also the discretionary benefits. And then of course, there are other things that impact how many people you have in the program that are getting those salaries and benefits, right? So what are your ratios and group sizes? And what are the additional staff you need to both keep those ratios and group sizes consistent throughout the day, right? So, that coverage, but also if you're going to offer planning time for staff, if you're going to have them do parent-teacher conferences, go to trainings, etc., all of that gets turned into a cost in terms of you still need to staff the classroom, right? So is it a sub? Is it a floater, right? All of those things go in that go beyond the simple of like, oh, we have 2 teachers in the classroom and that this is their salary. Well, no, there's a lot more kind of coverage you need to actually account for that properly. And this is where right now, maybe providers are making it work by, the director or assistant director going in there, or by having staff work overtime uncompensated. In a cost model, you can actually capture all of those costs. Of course, on the non-personnel side as well, we build all of that in. Rent, lease, mortgage, and utilities are often around 10% or so. But then other things like supplies and equipment, transportation, food can be a big one, and any sort of other administrative costs. Those are important. But of course, when you're talking about 70% of the cost being on the personnel side, that is the biggest driver of costs within the model. And just as we think about sort of what that looks like, there are a couple of tools that I developed when I was in my prior role at CAP. And, what these show, costofchildcare.org was a website we made to sort of very simply show the impact of different characteristics in a program on the cost of care. So this one over here is a sort of interactive you can go to on the website, and then you can say, okay, what does this cost look like if we have less children per teacher, if we increase salaries to one amount, if we increase them to kindergarten parity? if we provide benefits, if we have more planning time, etc. And you can see based on an infant, toddler, and a preschooler or a family childcare home, what impact those things have. Right now, this is statewide. It's sort of high level sort of information rather than actual rate setting. Like what I was explaining to you earlier was, you build the model that's actually used to inform rates. This is more a sort of advocacy tool, a sort of understanding the sort of policy implications. But it helps you see really easily what is that monthly cost per child right now, and what would that monthly cost per child be if we paid teachers health insurance, if we paid teachers the same as kindergarten teachers or somewhere in between. And I always like to show this chart on the left here, because in this sort of scenario we had in this report, and this 123 childcare center, just this the sort of childcare center A, the cost per child for an infant in this scenario was just over $1,200 a month. Right, and you can see kind of vaguely in these blue lines the different sort of how it was broken up. Salaries are down here, benefits. This is on an individual child basis, right, and accounting for how much of the sort of $1,200 that a family pays each month goes towards salaries. In the higher model, right, in the kindergarten parity model, and this was a US average, which is why that 2260 doesn't match the 1628 on the side. But the example is that in this higher model, in this more expensive version where salaries went up, yes, the cost of childcare is now about $1,000 more, right? It went from $1,200 to $2,200, but most of that money went to salaries and benefits, right? $900 of the $1,000 increase went to salaries and benefits. And so you start to see there that intersection of when you pay people more, it's going it is going to put the cost up, but you also then can start working your arguments back of what does that mean when that teacher now has that higher salary and those higher benefits, right? Is that teacher now not reliant on other public benefits? Is that teacher now able to, these teachers are not going and squirreling away that money into their yachts and second homes, right? They are going and buying more food for their family. They are buying shoes for their child to go to school. That is money that is going to go back into the local economy. So, as you start to think about like, this model might tell us it costs $1,000 more per kid. Where does that $1,000 go? It's generally not going into the pockets of CEOs. It's going into the pockets of teachers who are then going to spend it in your local economy. So then just the final thing, how does quality, so that's kind of how salaries get into there, right? Then we talk about quality, and we talk about building like a quality frame, which is like saying, okay, so if your basic cost model is like, this is the cost of childcare, meeting licensing standards, as you start to talk about, well, what about increased quality? It really falls into these three buckets on the right here, that are you changing your staffing patterns, right? Do you have more staff to allow more things to happen? Are you paying them more? And what is the amount of time that is being used for non-child contact time, right, beyond what regulations require, right? So, you might be required to do a certain number of clock hours of training each year, but, when you talk to providers, they often say, we want more training, or we want more time for planning, or more time for planning together, or looking at the data we've got on assessments, all of that. There is some cost, right, to the actual, doing an assessment, but a lot of the cost comes down to how are you making space and time for the professionals who are in doing this work to actually reflect. It's a really hard job, right? I don't think I need to tell the people on this call, like, it's a really hard job. And, one of the things that's coming up a lot right now, especially in this economy with sort of how difficult hiring is that pay is important. But there's also what is the sort of like work-life balance? What is the work sort of style like, right? Like if you are go for 40 hours a week with kids all the time and you never have time to breathe and think and plan for the next day, that's very different from if you have 2 hours a day non-contact time with children to really reflect on what you're learning, reflect on what you're teaching, reflect on the assessments, provide that individualized care. So one of the things you can do in the model is start to sort of account for all those different things, right? And account for not just what's the bare minimum, but moving on to the actually what is the best way we can provide developmentally appropriate care to the children here, right? Which might be, family conferences, professional development, additional materials and supplies, right? Having the time to provide support to children with IEPs. It also could be more external people coming in. Sometimes in cost models, we build in this idea about having coaches come in, or a curriculum specialist or a health consultant, either on staff or being able to actually have the resources to have someone come and be a consultant and come and do that work with you, right? And maybe that happens at sort of higher quality levels, but figuring out the cost model can help you understand what would it cost to do that. And you might build that into the subsidy rate. You might not. You might talk about that being a grant program, right? New Mexico, one of the things they did is, Washington State, one of the things they have right now is a planning time grant, where, it's not built into the rate, but it is, you can get a grant to provide a certain amount of planning time to teachers. And what they're giving you the money for is to hire a sub, to hire other people to do, to give the teachers the time to do that planning time. So that was like a very quick kind of like down and dirty on cost modeling. And I tried to kind of align it with where I think you all are, but very happy. I know, Sarah, you probably have some questions, but very happy if other people have questions and I can go back to slides, but what are people thinking?
Well, Simon, I've asked folks to put questions in the chat or let me know, but I do just have one, actually two kind of basic ones. So how do you get to this? So what are the steps to actually determine, are other states' cost models something we can adopt, or is it really unique to each state? Is it unique to community by community? What are sort of the steps do we take to get to this?
Yeah, that's a great question. So ultimately, if you want to use it for rate setting, I'm a big proponent of you need a customized model. Now, the federal government has the provider cost of quality calculator, which I helped design many years ago. And it's a very useful tool, but it doesn't necessarily allow for all of the customization, right? It's a 50-state tool. And yes, it has data. You can pick your state and it pulls data from the Bureau of Labor Statistics and you can override certain things. But by its nature, it's a sort of it's a sort of generic tool, right? So I talk about that as being really helpful for understanding some of the base numbers, understanding some of the intersections of different policy changes on cost. But if you actually want to use this for rate setting or actually getting to a point of paying providers, to me, that's where it gets down to, you want an Excel-based model that allows you to sort of do all of the specifics of that meet Kansas requirements. And honestly, like the way this has happened over the last few decades for market rate surveys is states tend to hire a research firm to do the market rate survey. Then they do some setting based on that. But with this, it really should be something that the state owns, right? Like you can build a model and it's a sort of a lift to build it the first time, but once you've got it, it's not that hard to update it over time, right? If you change your ratios, you just change the ratios on there. If you want to change salaries on there, you change salaries on there. You have a lot more flexibility when you have a specific model. Now, the other thing I always caution people on is like good data in equals good data out. And so, there's the model of being, what's the sort of structure of your system, but then you also need data on what are those non-personnel costs? What are the salaries? And, some of that you can take defaults, generally what do people pay for office supplies, right? But salaries and benefits are the big one. And it's a big one from a regional point of view, right? I know at the moment you have kind of 3 regional rates, but that question of, should you have 3 regional rates, right? Really comes down to, are you going to put in different salaries for across the state, or are you going to have one salary? So New Mexico just ended up doing one statewide rate, right? And partly because they moved everybody up to like a certain new minimum wage, and that kind of pulled everybody up who are in the more rural areas who are paying lower. Somewhere like San Francisco kind of built a cost model and then sort of added on a sort of special addition for the fact that it's really expensive to live in San Francisco, right? So, there's different ways you can play that. You could have a statewide salary and then you put a plus up for your metro areas, right? Or you can use this to say, we're going to have 4 different sort of salary points in the model. And what you do is you have one statewide model, but you have options where you can run it for those different regions. But again, you need good data from each of those regions to say, yep, this is this region of the state that we're running that model on.
Thanks, Simon. Amy, you have your hand up, so I'll let you come off mute and ask your question directly.
Thanks. This is Amy Gottjammer, and I'm here as a representative as a provider. So as a director of a large center, I'm coming at this from a slightly different perspective. So when I think about the cost, I'm thinking literally of what am I paying my staff? So rather than coming at it from the state's perspective and what is coming maybe from subsidies and things, I'm thinking, how could a tool like this be useful to me in terms of setting a salary schedule within my business? And so I'm hearing what you're saying, that this is more of a modeling tool and not a budgeting tool. I saw that on your slide. So I'm hearing that, but I'm wondering if since we're talking customization, if there isn't a way that it could be designed so that directors could have something that they could then take away from it that could be used as more of an actual budgeting tool for them, that where you could plug in, maybe it's a factor, like you say, a factorization based on your locality, because like say when it comes to pay parity, the school districts are based on mill levies and things that are happening locally, and so Johnson County is going to be very different from something happening in western Kansas and different from what's happening here in Lawrence. So I would need to have something really regional and local to be at pay parity with what's happening in my area. So I'm just kind of wondering if that's, I guess all things are possible, but just kind of wondering what you thought about. Have you worked with anybody in any of the other states? Have they talked about a tool that could then be sort of applied or made available to directors to use in that way?
Yeah. So it's a question that's actually coming up more and more recently in the last year or so, where I think people are seeing the benefit of having a tool like this sort of for that business side. I think the reason I caution about it not being a budgeting tool is because, like, when I dig into providers' budgets, right, you're like, there's so many different like nuances in there. What we do have is built in some customization of like, a lot of the models I've built would have a drop down essentially like in Excel for picking different salary points. And it might be current salaries based on the market, might be salaries based on the Bureau of Labor Statistics, might be salaries based on kindergarten parity, which could be statewide or could be, built so that it pulls from whichever district you're in, but also having a sort of user added value, right? So, and usually what you do in there is say, pick that, and then you could put in there, okay, I want to pay my teachers $25 an hour. And then it will like adjust everyone else's salary based on, normally you want to talk about what your leads are making. And then it will give you some numbers based on that. So, I think there's all customization is possible, is kind of the answer, right? The sort of basic model we normally build in, so this allows some customization like that, like mostly around salaries. I think where we have seen providers use it more is to understand the impact of different changes to the characteristics of their program. And so less being about the exact number that comes out, but more about, well, what would happen if I added an extra classroom? What would happen if I went from collecting 85%, being like 85% enrolled to 95% enrolled, right? And so that you can start to see the potential impact of some changes you could make, right? How worth it is it to call everybody on your wait list once a month, right? Well, actually, if that moves your enrollment up to 90% from 85%, and that makes this percentage difference to your income, right? That is helpful. Or understanding, I want to take more subsidized kids, but at what point does that cut out, right? You can play around with the revenue generator. So again, it's less about the number that comes out of it and more about the sort of percentage impact, right? To help you think about things you might be changing to your program. But ultimately, one of the things with this becomes like, who is building the model? Who is owning the model, right? We did some work with Sarah and Jenny, and CPPR on sort of doing some modeling for some thoughts, right? Sometimes the State Department will ask for a model, right? And then it's about how much are they making it available to providers. Sometimes it's an advocacy group that asks for the model and then it's available to everyone. So there is always those like who owns the model and who can sort of make those adjustments to it.
Thank you very much.
Yeah.
Jeremy, I saw you had your hand up, but took it down. You want to go next, or did
Sure.
he cover your, okay.
I just, as you're going through your modeling, sorry, Jeremy Fight, Hilltop Child Development Center in Lawrence. Just as you're doing your modeling, as I started working in this field a while back, do you consider, I called it self-suppression when we arrived. As childcare providers, we're like, what's the cheapest way I can do it to make it as affordable as I can for my family? So unintentionally, we are suppressing our own wages by saying, well, people can't afford it. How have you seen the market set when people just said, look, this is what it costs, we're gonna have to charge what it costs? You know, seeing, is there a huge backlash to parents going, I'm not gonna pay that extra $50 a month, or 75, whatever it may be, depending on if you're home or center or whatever it is. Do you see the personality of I would say the childcare provider, as we're always trying to make it as easy as possible on everyone else while continually making it harder on ourselves? Have you seen that kind of affect markets about how we set our own wages based on what we perceive to be a response rather than an actual response?
Right. Yeah, for sure. I mean, when you start kind of, often as part of this model development, we do this very intensive like provider data collection at the beginning, which can be both kind of surveys, but also like interviews and focus groups. And when we do the interviews with providers, it's amazing to hear, what people are doing for what they're getting paid, right? And when you talk to them and say like, I haven't raised my rates in 10 years, and it's like, wow, like that's really challenging, but it's like, well, I can't do that to my families, right? And you really see that's why we partly go beyond that's why that sort of price, cost, and true cost slide is so important. Because if you just sort of say what the cost is, right, you're reflecting what those decisions that people have made to keep their pay low, for the director to not actually pay themselves what they should be getting paid, right? Or to go to part-time, but still basically work full-time hours, things like that to keep their tuition low. Whereas true cost says to them, well, what does it take, right? And that requires, honestly, like a conversation with people, because people have been working in such a scarcity mindset. It's like, well, I can make it work like this. And sort of we have to sort of turn that around and be like, but how should it work? Both because you deserve to be compensated and to have a system that's set up properly, but also honestly, like we have a lot of childcare deserts across the country, including in Kansas, right? And a lot of people are leaving this field, and especially on the family childcare side, which is like the only care in some communities, as those ladies retire, there is no one else coming through there, right? Because that's just not a sustainable business model. So you have to move away from, this might work for you, but we need to be building a model that works for much more participants in this system, right? So that it doesn't only work if you are willing to do that compression.
Thanks, Simon. Kelly, David, do you want to ask your question?
Yeah, I had I'm not sure if it's a question or not, but I just want to say I really appreciate the opportunity to have this conversation as kind of a collective system. And I have a couple folks on my team that are actually working on some of that budgeting piece, the down into the actual budget of a childcare program, because what we're finding in work with communities, they come up with a plan to expand childcare capacity, but then as they go to seek additional resources, there's lots of questions about how much do I need? What do we need to ask for? So that is not rolled out just yet. It's in draft format. And I just appreciate this conversation because it gives me an opportunity, I think, to connect with some additional folks here on this meeting about making sure it's something that works for Kansas too. So thank you.
Yeah, and I mean, I would just say like, that's one of the things of like, there is sort of spectrum of cost modeling, right? There is the like, at your individual program level, there is like, what does the system need in terms of rate setting? But then there's like, as we talk about all these initiatives, and different states have talked about big initiatives, it's like, and then communities have talked about initiatives, it's like, how much does it cost? And can you back up that cost? Because for too long, again, in this system, we have said, well, can you give us 20 million and we'll do something? And then it's like, and people are like, we gave you 20 million, why didn't you fix the system? And you're like, actually, but if you show the cost modeling, we need 200 million to fix the system, right? And like, I think there is that scare of the big number is understandable, right? There is political realities we all have to live with. But I do think one of the things I'm seeing kind of working nationally is that more and more states are willing to say, and I think maybe there's a COVID kind of impact of this, of like, look, we stayed open for the last 2 years, right? When public schools closed down, we have been at the front lines. Like, childcare is essential. We should be honest about how much it costs, and we should start working to fund that way, right? And even if you can't fill that huge gap in 1 year's budget, being honest about what the big number is, backed up by the data, right? And the science of why you should pay teachers more and why that's important to kids' development and everything else, right? And the economy. And then, yes, if you need to make implementation steps, but I think having the data from a cost model really can help those arguments a lot, right? Because you can show, where did that number come from? You weren't just making up a pie in the sky number, right? It's based on data.
Thanks, Kelly. Thanks, Simon. Emily, I know you're doing double duty today, managing your family childcare business, but I saw you had your hand up. So
I put it up and I took it down a couple of times. I'll come on the video to make a statement since I'm not like running around the room. Not so much a question as much more kind of like affirmation of some of what I've heard, like feeling affirmed by a lot of what Simon is talking about. Like, you know, there are some big numbers here. And to Jeremy's point, like about like, at what point do we just declare, hey, this is what it costs, and so this is what we're going to charge? Some of what is going on, I do believe, is getting that courage to say, I am worth this, and this needs to be paid. And I don't know how it's going to get paid, but it needs to be paid because the work that I'm doing is worth this. And a lot of the workforce, whether that's in centers or family care, many people in the workforce are just now beginning to get the courage to say, I am worth this. And, you know, when I looked at the stuff in the beginning, at first I started to feel, here's another piece, baby. I started to feel like, oh, this doesn't really apply to me because their benefits, you know, my benefits are covered by my spouse, but why don't I deserve my own benefits? Because if something happens to my spouse, I have no backup plan, and I don't have the overhead to be able, or I don't have the P&L, I don't have the overhead to be able, or I don't have the P&L to be able to compensate if something happens to my spouse, and I can't depend upon him for the other end of all of this. So I do appreciate this conversation. One of the things that I would say is, as we go forward, is discussing, you know, modeling versus budgeting. Whether it's a small private center or a family childcare provider, some people are going to worry about being told what they're allowed to charge. And so making sure our modeling reflects what they're worth, and not just simply, you're allowed to charge this much and no more, and stuff like that, since we do have independent private businesses. That would be my only other comment.
Yeah, that's a great point, Emily. And it's one of the things that sometimes comes up on the salary side as well, right? It's like, wait, if you've put in this salary for me, is that the highest salary I can make? Like, are you telling me I can't make more than that? And the answer is no. It's right. It's that, like, we're making sure that the subsidy rate accounts for that salary. But if you can generate additional revenue to pay your teachers more, to pay yourself a salary more, like, that's fine. This is not a system. This is not making this a completely public system, right? Where it's like the public schools, where it's like, this is your salary schedule. It's about having a salary in the model to ensure that the rate is reflective of that, right? And honestly, like, unless you are getting the same amount from private pay families, you can't pay that salary based on you either got to be 100% subsidy, or you've also got to be able to get the money from the other side of that ledger, right? From the private pay families, which is why, like, rate setting alone doesn't solve everything, right? You also have to talk about eligibility, having more families be eligible for subsidy, because that's part of the other issue. Is if you say the true cost is $2,000 a month, the number of families who are not eligible for subsidy, who also cannot afford the $2,000 a month, goes up, right? So you have to look at it in a system-wide way and say, you know, how are we doing? What is our goal? And our goal is to provide affordable, accessible childcare, high quality, and teachers paid, and all that stuff, right? You've also got to look at not just the rate, but also who gets that rate, because families can't often afford that gap either. Yeah.
Amy Meek.
Yeah, I had a comment, I guess, or maybe a question similar to Jeremy and Emily's thoughts. Used car price exploded families can't afford to pay more for a car, can't afford to pay more for housing costs that have gone up, food costs, gas. We just do ourselves a disservice a lot of times because we don't, as everything else is going up, we don't raise our prices, or just, I guess my question is more, how do we let people know and start advertising the true cost? And is it when a parent comes, you say, here's my rates, however, I'm going to give you, this is how much it costs, but I'm going to give you a discount. But I think it's more even outside of our families. It's how do we start talking about that and really, I threw out an idea. I think last meeting is crazy. Nobody would do it. But what if we just say on June 1st, we're all going to charge the true cost? Everyone, what would happen? The system would be kind of a more of a crisis than it is now. But we have to have a start. We at some point have to jump to that, I guess, is what I'm saying. And I don't know how we get there.
Yeah, I think the idea about being honest about what the true cost is, right, is important. One of the things when I first developed that interactive tool a few years ago, we piloted it with a few parents in DC who were at the organization I worked at, and they were like, well, this seems crazy. This seems really high. Like, I'm getting really good quality care at my program for $1,200 a month. And my first question would be, what are your teachers being paid? Do you ask when you do a tour what the teachers are being paid? Because I bet you they're not getting paid what you think they're getting paid, right? Because if you're providing it for $1,200 a month, they're not getting paid what they should be paid. And one of the things we did in that report was we broke it out of like, this $1,500 a month, this is what goes to teachers. This is what goes to this. Because I think sometimes, and even doing it on the classroom level, right? Because people are like, well, wait, if we're all paying this amount for these 10 kids in this classroom, and you've got 2 teachers, that's this amount. And then you're like, wait, but what about taxes? What about benefits? What about paying something for the director? What about the rent, right? Breaking it out so people sort of see where the cost is at an advocacy level, I think could be really informative. And then, yeah, I think the question of saying to families, like, this is our cost, but we offer scholarships because we know you can't afford that, does help socialize the idea a bit more about like what it really costs.
Lucas, I know you had your hand up and then took it down and then put it back up. I think you were next in line.
Thanks, and I appreciated the presentation. I was in and out a little bit with wrapping up construction on a new facility. I think one of the things that we've been talking about here in Lindsborg is we are trying to charge true cost. Is we assume that will motivate parents to advocate for themselves in Topeka. And we're not really interested in doing that advocacy as a childcare center. We want parents to be calling their representatives and senators and saying, you need to help. And I don't think, short of actually charging what it costs to provide high quality childcare, nobody's going to drive that conversation. As long as we're making it work, as long as providers are making it work, Topeka and DC, I think, are quite content to let the system work. So thank you.
Thanks, Lucas. Bring up a very, very good point for all of us to consider. Nikki, you have your hand up next.
Yeah, I just want to mention, so right now, I think we have a good example of something that works, that's kind of set up with the true cost in mind in our Kansas Early Head Start Childcare Partnership, where we have, the subsidy pays for some of the children, not even all the children in the classroom, but then there is grants that go into those classrooms that help offset that cost of higher quality care, and it offsets the cost for the entire classroom, including like community slots. And these, we would call these in subsidy, we'd call these add-on payments. And so when we look at like links to quality and the QRS system, once it's statewide, we know that there's costs associated with these higher quality levels. And so we can do we can do differential payments with subsidy. We can do add-on payments, which would be across the board for classrooms, because I really am still uncertain there's going to be enough subsidy participation. I don't know of any providers that have 100% subsidy participation rate to be able to offset the true cost with subsidy alone. I think it's going to have to be a combination, of add-on payments, or Simon called them grants. But I think that's the approach that we would have to look at. And obviously it would depend on funding available, because I don't think we could expect families to be able to afford the true cost of care throughout Kansas. And right now with subsidy, we have it at 250% of the poverty level for the income eligibility, which is really pretty high. Our rates are at the 85th percentile of the last market rate survey. Now, that is the market rate, and Simon's explained why that's problematic, but I still think it's going to require major changes. And we do see some stuff happening on the federal level that seems encouraging. So I think, people might recognize it's a problem. And I understand what everybody's saying about maybe the parents really need to see it and be charged the true cost of care. But doesn't that seem very scary to do that?
Thanks, Nikki. I think your comment about the federal movement at the federal level is a good one. And I don't think anyone is suggesting that families bear the burden. I think the cost modeling, one of the benefits is to see the gap and see the amount, and then think of strategies of how to fill that, not necessarily saying we have a two-payer system and let's have those two payers pay more. What are other options as well to think about? So I just noted the time. We are officially at our break. If you want to stay on until 10:10, I'm going to ask Simon to stay until that 10:10 time. But if you need to step away, feel free. And just given the time, I'm going to move to Cassandra because I don't think she has had the opportunity. And Emily, will go to you after that.
Hi, I'm Cassandra Science. I'm the family delegate for Kansas MCH and Title V. And I'm a special needs mom of two boys with autism. And so special needs is my passion. And so I advocate for them. I just wanted to make a comment on the advocacy piece that Lucas brought up and getting parents to do that. I think we need to work on helping parents learn how to advocate. And that's kind of one of my passions as well. I've been advocating for 8 years now with the Family Advisory Council, with KDHE, and it's a lot. I mean, it's hard to advocate and it's scary to advocate. And I don't know that, there's a lot of times parents don't want to advocate because they're afraid. So we need to work on that with our parents and show them how to advocate. I mean, yes, as child care centers, you don't want to get involved in that, but if we can work on maybe helping them to know what to do or how to do it, then maybe that way we can help our parents to go to Topeka, go to DC, and help this process. That's just my thought.
Thank you, Cassandra. You are a wonderful model for us to scale and across the state for other parents. Emily, go ahead.
Well, I'm actually also, again, going to kind of affirm what Cassandra was just saying there, in that, yes, there's needs to be a good level of education on advocacy. Advocacy is hard and it's intimidating. And to be frank, it's kind of designed to be hard and intimidating. That's kind of the purpose of it. And so, you want that? Okay, sorry, we're switching movies.
Emily, you hit the mute button, I think.
We do as a collective is consider whether or not we're feeding into the us and them mentality. You know, parents, it would be cruel to just simply say, hey, this is what I'm worth, this is what it costs me to do this, so this is what you're going to pay, and then just point blankly give 30 days notice and all of a sudden their costs go up by $1,000. That's cruel to families because it's unreasonable to think that they could take that on. But then like Lucas, for what you were saying about you want parents to do this, it's hugely important for that. However, there does need to be a coordinated effort so that way we avoid the us and them conversation that we've come out of, you know, in the mentality of scarcity that we have bred for all these years. We've also been up against an us and them, that who is suffering more? Well, everybody is struggling and we can work together. And so part of it is ensuring that families understand, ensuring legislators understand, and that what we're doing is doing it collectively so that we help people understand that in doing this, we're working together for the benefit of the kiddos, because that's who this is all for in the end anyway, are the kids. And so we have some work. And so I see this as being a very long range effort that, you know, this is a systems problem. And that, you know, when we talk about systemic change, this is an example, a prime example of what Kansas has ahead of itself. We have systemic change that we have to make, and we either have to be willing to dedicate ourselves to it or continue to complain about it and not take action. And that is what I see the point that we're in. We're at a decision point where we get to say, these are systems changes that need to happen, and here's a coordinated way that we can do it to benefit everybody.
Thanks, Emily. I have one more question for Simon, and then Lucas, we'll get to you. We're talking about solutions. How can the model actually help us stress test solutions, like inching solutions, big solutions? Like, is it a tool that we could use, and what are the kinds of solutions we could stress test using the model?
Yeah, I mean, the model kind of does two things in terms of cost. It tells you a cost per child, but also a cost per program, right? And so to sort of Nikki's point about, you know, not all of this being on the rate and the other things you can do, like that is one thing you can do with the model. Is it's a cost model, but it's also a revenue model, right? You can integrate the revenue in there to show what are you getting from subsidy, what are you getting from tuition, what might you get from grants or add-ons. So you can help sort of show that like mix of, okay, but a program that looks at this size, that has this much subsidy, this much tuition at this level, what's still the gap? What are the different ways we can fill that gap? So that's the one piece on the sort of cost of childcare model. The other piece is that there's also other models we build that are more systems level models, right? Which takes the cost of childcare number, but then puts that into the context of how many kids do you want to serve across the state? What are their income levels? What are we expecting families to pay? And then kind of bring in this broader sort of systems level component, right? Which also gets to like, what are the supports that providers need? Because at the moment, this is a sort of a lot of private providers operating, sometimes connected through groups like this and other groups, right? And sometimes not connected. And that question of so much of the burden right now goes onto the program. And one of the things we do in our sort of work around the comprehensive modeling is say, how about we move some of that burden on the provider and move it up to another level? Maybe it's the state level, maybe it's a regional body, right? And say, how can we move some of that? There's things like shared services models, but even, you know, separate to that, there's just like access to shared professional development, access to sort of networks where you have supportive coaches or, you know, other professional development, so that everything isn't on the burden of the provider. And so what you can do is integrate those things to see, well, how much does, if you move some of that cost away from the program and move it to the systems level, that makes it sort of more affordable for the families at the provider level, right? But there's a cost still there for the state and the system, but it's like talking about all of this gets to like, there are costs to do this well. Where should that cost land, right? Who takes the burden of that cost? And you know, the models can help you sort of stress test and play around with different options for that, basically.
Thank you, Simon, very much. I'm just noting the time, and you guys have held on through the break time. I just want to thank you, Simon, for taking time this morning to join us. And I think we all learned a lot and definitely furthered this conversation. So Simon is around in terms of connected to Kansas. So if we have any follow-up questions, please feel free to email those to me or to Jenny Welch Buller. And we would be happy to get those to Simon, and maybe we can schedule a next conversation if we get further down the road. So Simon, thank you again for joining us.
Thank you for inviting me to speak with you. It was good to connect with you all this morning.
Thank you.
Thanks.
I see Amanda is back, and I know we have Amy here, so I will stop my facilitation and turn it back over to you, ladies.
Terrific. Thanks, Sarah. Amy, is it helpful for me to pick it up from here? Terrific. Thanks so much for filling in. I appreciate it. I will give everybody a minute just to come back together. All right, well, my clock reads 10:10, and I see some people from the family navigation group hopping back on. I gather that the other two groups had a really terrific conversation and also did not have a break. So I recognize that it is Friday morning and that we all perhaps want to wrap up this meeting and go on to other things, but I'm also wondering, just like show of hands, would it be helpful to take a really quick 5-minute break to be able to get up and stretch and come back together before we dive into another deep conversation? Yes, I see yeses. Okay, so we will come back together at 10:16 Central Time. Thanks, everybody.
Good. I got to go snuggle with some 2-year-olds for a few minutes. Now I'm happy.
Always a good thing, Amy.
It is.
Hi, everybody. Thanks for your flexibility on a lovely Friday morning. I'm definitely a lot happier with a fresh cup of tea. And I'm glad to hear that we had really terrific conversation in our work group. So I'll wait to see a couple more cameras flip on before we report out. Cheers, Kelly. Are you a tea or a coffee person?
I'm both coffee in the morning, and then I switch to tea for my afternoon pick me up. But
There you
cheers
go.
to you as well.
My green tea with a little bit of mint is beautiful this morning. Well, hello, everybody. I think that we will go ahead and get started. I'm Amanda Peterson speaking. For those of you on YouTube, thanks so much for Amy for tagging in for me this morning to help get us kicked off. And I am so glad to hear the report outs from each of our work groups. So I know that our childcare recruitment and retention and quality and environments groups came together for this morning, and I'd love to hear a report of all that was discussed.
Hi, Sarah.
ahead,
Do you want
Jenny.
me to jump in and give a?
Yes, please.
Oh, my notes are a mess, so I'm going to do my best. There's just so much we talked about. It was it felt like a really fruitful discussion. So in our combined work group, we had Simon Workman come as a guest speaker to share a few slides and talk a little bit about the true cost of care and cost modeling work and how that can inform so many things, how it's different from a budget, a program level budget versus how it really informs broader system and policy decisions. Talked a little bit about subsidy, talked about what really truly goes into the cost of care, or the difference between the cost of care. Let me make sure I do need to reference my notes, even though I should know this by heart by now. The difference between the price, which reflects what the market can bear, the costs, which reflect the actual expenses that are incurred, and then the true cost, what really estimating what a high quality program and increased workforce compensation means at a systems level, and then looking at the gap and then having conversations using that data to inform what we do about closing that gap without putting the entire burden on providers or families. So a lot of really fruitful, wonderful discussions. I think we just kind of got the tip of the iceberg, but inspired a lot of next steps, I think, behind the scenes to use some of the tools that we have been working on so far to run some scenarios and begin having more detailed conversations about what that means. Sarah, is there anything or others that really stood out to you that I missed in that summary? Okay. All right, thank you.
Go ahead.
That's it. Thank you.
So this is Amanda. And so did y'all get in at all to, like, I'm trying to wrap my head around how we all might use this tool, or like, can you give maybe an example of, gosh, here's maybe a problem or a project that you'd be that we'd be working on where this kind of thing could be helpful?
Yeah, we did talk a little bit about that. So one of the, he said it's a good way we can use the tool to stress test some scenarios. So for instance, if we wanted to integrate some different levels of compensation and then see how that would impact, and again, it's estimates, right? So it's based on estimates. And then we would see like, what's the gap between that and the current revenues? We can run, and a lot of it is based at this time based on data that is market-based, and the current subsidy. And we did talk about how subsidy can't solve necessarily for completing that or filling the entire gap. But yeah, it can help us run different scenarios on how many, if we were to change, excuse me, you can change ratios or not ratios, you can change the different revenue coming in and look at different staffing models, benefit models, and again, just take a look at what that costs overall. And education too, we talked a little bit about how the tool can be really useful and has been useful in other states, or the modeling itself in helping others, really helping not only families, but also providers themselves recognize some of those costs that are covered in kind, and also truly what goes into it, and recognizing, for instance, that salaries compose at least 70% of the overall cost. Sometimes I think just that education piece Simon has discovered is really helpful for a lot of different stakeholders, or different parties. See what truly goes into the actual cost, and then talking about what it really would cost to give the right amount of staff time, right? So to give directors the time to do some planning, to actually provide some different benefits. And then we did talk a little bit about some creative ways that are being models that we do have in the state that we could explore too when it comes to grants that can be provided. So it doesn't necessarily always have to be built into subsidy. Closing the gap does not always have to be built into subsidy, for instance, or into the parents' pay, but could be provided through grant mechanisms. So we can plug those in and see what that does. So yeah, excited to get a little bit deeper into it with some folks here.
Thanks, Jenny. That's really helpful for me. Other work group members, did you have? Oh, yep. Go ahead, Amy.
Yeah, this is Amy Gotchamer, and just again, as a provider, we just mentioned too that if we could allow, make sure that the tool is available to providers and other stakeholders that might have use for it, like for me to be able to use it perhaps as a way to speak to my own families, or to use it to help in producing salary scales or things that might be helpful within my own business.
Thanks, Amy. Other work group members, anything that really stuck out to you that you'd like to share with the big group? All right, then family navigation group. What all did you talk about today?
Yeah, we sort of continued a conversation around the promotion of 1-800-CHILDREN. And we shared, some ways that other organizations or entities are sharing information well. One was the Tiny K model in Leavenworth, and how they review this brochure that's given to school districts and hospitals and childcare providers and anywhere there are children in the area, and have been really building that partnership structure for the past 10 years. And they look at this brochure every 2 years for modification. And so just thinking about what would that look like to scale, across Kansas, is that feasible in other areas? And then we were really trying to get to an action step, and where we landed was just really promoting 1-800-CHILDREN via social media, and how everyone in the panel could be involved in that. So be on the lookout for more information on like a social media campaign that our respective agencies can repost based on their own messaging. So that's something that we're trying to make happen. And we also just mentioned how 211 is a resource that's available to families all across the nation, but making sure that our local agencies have 1-800-CHILDREN on their 211 list, so that the families that come to them with needs will have that extra resource. Is there anything I missed on that subject before I go on. Then we talked a little bit about, kind of had a conversation as an update on that home visiting presentation that we all sat on months ago. And just we're wondering, what the status on that was, if they had seen a response, an increased response based on their marketing efforts. And it was a little premature because they had, they were in the middle of a plan to get that word out. And so while there's not a pulse on the response, they are ahead of schedule on their plan. So that's encouraging. And, we just made the comment that it'd be nice to hear back from them, at the appropriate time after they have had a chance to review the impact that campaign has had. And I think in turn, they're also wanting to hear from us in our own areas, if we have seen an increase in home visiting interest. And there was also a comment made that, oh, that's a new subject. Anything else on that before I move on?
Crystal, this is Amanda Peterson. Can I make sure I'm tracking? So that's the, I'm remembering there's an all-in for Kansas Kids funded sub-grant, preschool development grant, sub-grant for, I think it's DECA who's leading those efforts with like billboards and stuff. That's okay.
Yes, that's the one I'm referring to.
Yeah.
And then we moved into kind of in the realm of home visiting, how are we supporting friend, family, neighbor care providers in what they do and in the opportunity to become licensed? So we had some discussion around that and just really in the beginning stages of identifying what the need might be, which led us into a broader conversation about supporting licensure and that next step and identifying the resource of the childcare health consultants that have recently been employed through Childcare of Kansas, but also looking back to how do we connect the dots? So, do the friend, family, neighbor care providers know about that resource? Do they know about licensing in general, and kind of throwing in the prevalence of refugee populations or undocumented populations, and the fact that we know that they are providing care. What resources do they have for understanding safety and the laws that we have here for providing care? So didn't really get very far, but just, had interesting conversation around it. But that then led us to a conversation around just what messages are important for families around childcare. What do families need to hear? And so the main topics that came from that were if childcare is affordable to them. So if they might be eligible for state assistance. I know in this area, there's a lot of families that my program has heard from that has applied years ago, but don't know that there have been lots of changes made and they might be eligible now. So just helping get the word out of types of childcare, whether it be in-home, center, and the importance of early childhood education. I just think, we can never not stress that enough and not take for granted that we have this wealth of knowledge that a lot of people, just clearly don't for so many reasons. So again, our action steps were more around the 1-800-CHILDREN, but we did have really good conversations about, where we can go next with messaging efforts and helping families connect the dots.
Thanks, Crystal. Panel members, do we have any questions for the Family Navigation Group or Family Navigation members? Do we have anything to add? All right, then Crystal, we'll all be on the lookout for 1-800-CHILDREN things that we can share on social media to help spread the word. And we are running actually right on time. So Michelle Allen and Megan Smith from the Department for Children and Families, I will turn it over to the two of you to visit with the group about the Child Care Development Fund plan and how we can engage. Thanks for being here today.
Thank you, Amanda. Just want to thank everyone for having us. It was almost exactly a year ago today since the last time that we kind of gave this full presentation about all of the things that we're doing with our pandemic relief dollars. Initially, that conversation was this is what we're planning to do, and now it's really exciting to come to you and say this is what we have done and this is what we're still working on. So just want to thank you all for the opportunity. I am Michelle Allen. I am the CCDF Pandemic Relief Project Manager. I've been with DCF for about 2.5 years. And then I'll also give my partner in all things, Megan, a second to introduce herself as well.
Hello, I'm Megan Smith and I'm the CCDF Program Support Specialist. I have been in this position since October. Some of you may know me in my previous position with Links to Quality as the Development Specialist. But I've been with DCF for over a year, almost 2 years now. Yeah. So yeah, it's good to see you. And Michelle, I'm glad to have you back.
Yes, I will say this is my first presentation coming off of maternity leave. So we'll get all the words out there. And if things start not making sense, we'll figure it out as we go, right? You may also hear my sweet angel baby screaming in the background. So just want to begin with some goals for our discussion today. We are hoping to just start us off with a common understanding of what CCDF is and provide some background information. I think that when I came and spoke last year, we probably did the same thing, but I think it's always helpful just for us to talk about all things related to CCDF and the things that we're planning to do with these dollars with that kind of framing in mind. And then also just want to spend some time working through the outline and the timeline, just talking about things that we've completed, things that we're working on right now, and things that we are still planning to do. And then also just want to provide an opportunity to ask questions, give feedback, things like that. So the Childcare and Development Fund, DCF, is the lead agency for that pot of money. And we are responsible for distributing those funds and making sure that we meet all the federal requirements for the use of those funds. So there's several key goals for CCDF that we're regularly monitored on. We have a state plan for this, and we work together with many of the people on this call to make all of these things happen. But some of those goals include providing leadership and coordination, promoting family engagement and consumer education, providing stable childcare financial assistance, meaning our childcare assistance program, ensuring equal access to childcare, establishing standards to ensure health and safety. So our licensing team, they have lots of federal requirements around that, recruiting and retaining a qualified workforce, supporting continuous quality improvement, and also ensuring grantee accountability. So all of these fundamentals are part of the federal guidance, again, that we receive from the Office of Child Care. So it's very, very important that we kind of base all of our decisions and ground ourselves in these goals as we move through or continue, working through our planning phases. So as a part of our goal to provide leadership and coordination, there are lots of different entities that we maintain relationships with and collaborate with on a regular basis. So some of you may be familiar with this, and others, this information may be new to you. Obviously, childcare providers are a key component of the work that we do every day, but others that you know and also are represented here are the local childcare resource and referral agency, Part B, Part C services, licensing, like I mentioned, Head Start, and then also links to Quality. I do just want to note that within this gear, we really believe that the families and the children that we serve are really central in making this work. That's really why we're all working together as much as we are to make these things happen.
And Michelle, if you don't mind, I'd love to just highlight, since we don't use this acronym all the time, but you'll see that gear that's kind of light gray in the top left that says ECAC. That stands for State Early Childhood Advisory Council, which is a federal designation. And I'm sure you all remember that in Kansas, our Kansas Children's Cabinet is our Early Childhood Advisory Council. And the reason why we exist as a recommendations panel is to serve as an advisory group to the Children's Cabinet in their role as the State Early Childhood Advisory Council. So we might not all immediately see and cue that, but it is actually a really important federal connection when we're thinking about responsibilities to consult with and collaborate with the State Early Childhood Advisory Council. Sorry to interrupt, Michelle.
Yeah, thank you, Amanda. So just some other entities that I just want to highlight are child welfare, local governments, and tribal organizations. So I think that it's easy for us, right, to think only in the mindset of like, oh, these people work directly with children, or these people make the policies that guide the work that we use to work with children. But it goes so far beyond that. We really want to make sure that we're taking a holistic approach. We're really required to take a holistic approach to the work that we do every day. So similar to what Amanda said, when we think of the governance structure within Kansas itself, there are 4 key agencies who play a role in the early childhood system and make up the early childhood state directors team. They meet every other week to keep each other updated and make decisions collectively about early childhood at the state level. So DCF, one piece of that pie, right? So within our state's child care development funds, we're able to provide ongoing funding and partnership for several contracts throughout the state that deliver programs and resources for childcare providers, children, and families in Kansas. So some of the things that we fund with CCDF dollars under DCF are the Resource and Referral Network, Childcare Assistance, the Enrichment Network, Workforce Development, Links to Quality, our KQN website, which is our federal consumer education website, the Infant Toddler Specialist Network, Early Head Start, Childcare Partnerships, and then also childcare licensing, which we know is housed at KDHE. So before I move on into kind of the relief funding portion of this, I just want to stop for just a moment and give an opportunity for questions. Okay. Perfect. So when the pandemic first started, we knew that we needed to act very quickly to do our best at mitigating as much financial burden from our childcare providers. This was life-changing, right? So when we very first started, we released the Hero Relief Grants in partnership with Childcare Aware of Kansas, but we wanted to do more. So many of you may remember some of the spreadsheets and documents that we were sending around to gain feedback, and several of you I know provided some feedback. So some of the things that we heard from you all and also from childcare providers in the field were that we were really needing funds to offset the cost to operate business and help manage the loss of income due to the pandemic. The field needed help with those that missed work due to COVID, both for families and employees. We were asked to waive licensing fees. We need help to stay open and help with startup. Training, support, and resources. And then also, there are just so many places to go for information. It would be nice if everything was just in one place. I think that we all experience likely some of that information fatigue just trying to sort through everything and make sense of it all. So as the pandemic has continued, we have really worked to center the voices of the providers in the field and also our partners. We're continually listening to things that come up so that we can really center around the feedback and things that we're hearing. And we also look to engage our providers as much as we can as we are designing different opportunities and also helping things to roll out. So since the beginning of the pandemic, we've worked in several different kind of areas. So we'll talk about each of these things in kind of its own bucket. So the first one is those direct provider supports. So I just want to note and celebrate a little bit that since the beginning of the pandemic, DCF has allocated over $265 million to childcare providers directly with the support of our partners. So we've worked with Childcare Aware to deliver the Hero Relief Provider Funding, which provided over 8,000 different types of grant opportunities, totaling over $11 million. And then we've completed 2 rounds of sustainability grants. The first with that CURSA pot of money, totaling about $43.5 million. The second round of sustainability grants that totaled about $47.5 million. And then currently available is our round 3. So there's over $160 million available, and that will be available on a monthly basis. We have received 3,429 applications for that so far. That is a rolling application. So if you're listening in or on this call, and interested in that opportunity, that application is still available, and providers will continue to receive those funds over the next 14 months. So the last thing I just want to note is the childcare appreciation bonus has been a slightly challenging process, but we know that that is something that we have heard loud and clear and that we really decided was a priority for us. So we're hoping to make this application process as easy and quick as possible for all of our childcare providers throughout this state. So more to come on that very, very soon. And then I just want to highlight a couple of things around sustainability grants. So again, that application is available on a rolling basis through November 30th of 2022. And then the funding amount will be the same for the initial 9 months. For the second 5 months, we will make the determination on those grant amounts at a later date, just based on the amount of money that is still available. We want to be able to expend as much of that money as possible. So we decided to make that decision on that later portion at a later date. So these grants do aid in continuing operations and childcare programs throughout the pandemic. Childcare facilities who maintain an active permanent KDHE license, whether remaining open or temporarily closed, are considered to be eligible. And information about this and also the application are available on Childcare Aware of Kansas's website. We know that there is not enough workforce or childcare providers to meet the demand of families in Kansas. So we're really hoping that the several different startup initiatives will provide resources necessary to encourage individuals to join the field, and also communities to help find creative solutions that address their unique needs around childcare. So our Childcare Health Consultant Network is a free service, also available through Childcare Aware of Kansas to all childcare providers throughout the state. Their services are primarily focused on promoting health, safety, and wellness in childcare environments, and they offer one-on-one coaching and planning sessions wherever and whenever you need it. Additionally, we have licensing fees and background checks covered through the American Rescue Plan Stabilization Funds through September of 2023. And then we also recognize the important role that communities can play in the future of childcare. So we'll continue to support efforts with the addition of community level grants for those who may need to have some additional support as they work to implement their plans. So more information on that specifically coming soon as well. Additionally, we have some different opportunities around quality improvement specifically. We know that this is something that's really important. We just want to make sure that children have access to quality childcare, because we know that that helps them to have the best start in life. We know that it's a necessity, but we also know and recognize the expense associated with it. So we're really hopeful that these initiatives will help us be able to support quality environments that the Kansas childcare providers seek to build or sustain through grant opportunities, peer support, coaching, centralized resources, and discounted purchasing. So program administration support is a free service available through Childcare Aware of Kansas to all childcare providers in the state. And they focus on promoting solid business practices in childcare provider environments. They offer one-on-one coaching and planning sessions that are provider and program driven. Some other things that we want to highlight coming up is childcare quality improvement and support. So within that, we see the links to quality implementation, which will be a voluntary quality improvement system. I know Rachel's here and could share a little bit about that if anyone is interested. And then also shared service networks, providing us an opportunity to leverage services at a larger scale. And then we're also working on a shared resource platform that will include an online catalog of templates and resources to support childcare providers and programs. And there will also be a connection to telehealth and teletherapy services at a very affordable rate. So then our workforce supports are focused on recruiting professional development through education, training, and or technical assistance, as well as retaining a stable and knowledgeable workforce. So some of the opportunities available currently are increased professional development and scholarship. Those are available through Casito, mental health technical assistance, also available through Casito and the Infant Toddler Specialist Network. So really working to support a strong understanding of social emotional development of young children, and also supporting children with disabilities, also available through the Infant Toddler Specialist Network. And then we're also working on the workforce registry. I know that there's a lot of interest in information around that. I will say that the RFP is currently posted and available through June 8th. So we are somewhat limited in what we can talk about. However, if you're interested, I'd be more than happy to find the link so that you could read through the RFP at your leisure. And then one other thing, to make all of this work happen, the DCF team needs some support, right? So we do have a marketing and outreach team. We are working with Mammoth Creative Company to work on all of our messaging and information sharing related to childcare, just generally around childcare, and then also specifically around these relief funded initiatives. And then we also are working with a backbone support team currently that is CPPR to help us have just some administrative and strategic support because Megan and I cannot do all of this work on our own. We also just want to highlight some of the family supports that we've been able to implement. We've talked about childcare assistance a bit already this morning, but just want to note that we did raise the income limit to 250% of the federal poverty level. And we also removed the family share deduction for essential workers during this time. One other thing that we're working on and we're really excited about is the Family Needs and Preferences study. We really want to understand the drivers behind low participation in DCF childcare assistance. So this will explore both the family perspective of that and then also the childcare providers. We know that not all childcare providers in the state of Kansas participate in this program, and we do just want to understand if there's anything that we could do on our end to support participation, both again for families and childcare providers. So just want to dive into some of our child care assistance changes that we have made really since the beginning of the pandemic. We raised the income limit from 185% to 250% of the federal poverty level, and also changed the benefits to blocks of time based on the total calculated hours of care needed per month versus having it done on hours specifically. And then we also removed the family share deduction for all families with an income at or below 100% of the federal poverty level and reduced it for others that are between that 101 and 250%. And then also increase maximum rates to the 85th percentile for all age groupings. And I do just want to note that childcare assistance really is a central component to CCDF spending in a regular non-pandemic year. We are required to use 70% of our funds on childcare assistance specifically. So our goals are to help families access affordable quality childcare so that they may go to work while their children are receiving benefits in a safe, quality early learning environment. So I will stop talking for a moment and allow time for questions, comments, and I'll also stop sharing.
I'm happy to provide some comments just because the providers that we work with in Minot County have just seen so much or just been so grateful for this funding. And I've heard time after time, I don't think we would still be around if they didn't have those sustainability grants. And we've been very tied to the subsidy process for my program specifically for the past 4 years. And we provide a little additional funding for families if subsidy doesn't cover everything. And for the first time in 4 years, we're hearing families say it's covered, like they're entire. Now, I think our providers kind of have low rates. So the cost of care model is very important to this discussion, but it's making a big difference in both families and providers, and just appreciate everyone's collective efforts on it all. It's really making a difference.
Crystal, this is Amanda Peterson, and I think my question's a little bit for you and a little bit for Michelle and Megan, but I know that part of that work has been helping families navigate the process to apply for subsidy. And so I'm curious what that's looked like. And then I'm curious whether we're seeing an increase in the number of children and families served when we look at the statewide data. I know that some of that's coming with the family preference survey later on.
I think I'll speak to a little bit of the second half of that question, just around those who are receiving the benefits who maybe didn't receive the benefit before. One of the metrics that we are tracking on a regular basis when we receive information from our reports team is that 185% to 250% of the federal poverty level and the number of children participating within that range. So that is something that we're tracking on a regular basis. And I know that our team has a lot of interest in.
I think our program's kind of seen it all on just the ability to access those funds. I've seen a lot of families who just been able to kind of use the online login and apply and be approved in a pretty reasonable amount of time. And then there are a number of families who just, there's some sort of communication barriers that, eventually it'll work out for them, but it takes some time. And, there's been I think with the influx of applicants, it's probably put a pretty big load on the DCF local offices. So, I think there's been maybe some growing pains there. But, overall, just seen a lot more approvals of the families that come to us for support than we had in the previous three years. And the child support requirement is still a major barrier. And I know that DCF alone can't really do much about that. That's really a codified thing. So it's still a major barrier for many of our families. But for those who can work that piece out, it's been very beneficial.
Amanda, I will also, this is Megan, just note, as Michelle had mentioned, us trying to work through that family preference and needs survey. We're hoping that we'll get some really great data and information out of that to help further understand those needs and some additional barriers to like what Crystal was talking about. And then also hopefully working with that group to maybe talk about ways that we strategize how we can maybe overcome some of those things, and how we as a state can really help increase that access and participation in our subsidy program, both for families as well as providers. As Michelle said earlier, CCDF fund, 70% of that is dedicated to our subsidy program. So the more participation, we want to be able to provide as much as possible.
I just want to note one other thing with that too. I think that when we think about childcare assistance, it's really easy for us to think about the child gets childcare assistance and then they go to a family-based childcare center or facility or a licensed childcare facility. That is maybe a little bit larger, but we also have relative care, and we understand that in some circumstances that really is what is best for a family based on, their preference or just what works for their families. We think about non-traditional hours, having grandma watch kiddos while parents are at work, second or third shift may make the most sense for them. So we recognize and just want to also really encourage the family choice. Families are in charge of their decisions around their children's care. And we know that a licensed facility isn't always necessarily what is going to be best for every single family across the state.
Thanks, all three of you. I appreciate that. I appreciate all of that. Do we have any other questions or reactions, panel members?
This is Tanya Bullock. Can I make a comment? I think just Megan and Michelle, one way we try in our program to really support providers who were just absolutely against getting on the DCF subsidy program, what we try and tell them is, would you be just open to doing the paperwork and being a provider who would support it in the event that you have a family who comes along who really needs it, and even if it's just that one family, because they always tell us, well, I don't have any families who need it and I'm not going to do it. A lot of providers, we can help through the process and support them to become a provider who does support it, even if it takes months before they actually accept a family. Eventually, a lot of them do end up supporting even just one family. And that's what we tell them. It just takes even just that one family they can support. And typically it takes that one family to walk in the door and make them change their mind. So if we can just get them to do the process and help them through it is that first step, and that's what we try and convince them and support them in doing, and we usually end up going back and finding out that they were able to help a family. So.
And along that vein, I think a lot of providers, if they were familiar with things 2+ years ago, they encountered a lot lower, depending on the area, the actual subsidy amounts were not nearly as high. And so then the families, would tend to rack up much higher bills, and then it would be unsustainable and just kind of create this transfer of families. And, in my area, I don't see that happening as much, but I don't think providers who maybe were familiar with that years ago understand that major changes have been made, and they're less likely to see some of that happening.
Go ahead, Emily.
Of course, White, when I talk, I got trying to getting upset. I think then it's important to make sure that providers know about these changes and truly understand the changes, because I have been, I'd had a contract with DCF for the intention that Tanya was talking about, that it's at least up and running if anybody comes through my door, and nobody came through my door despite living in a neighborhood that could utilize it. I moved into a new neighborhood, and when I moved, it wasn't feasible at that moment just due to the license change and things like that. And so what DCF and I agreed was that I would re-up with my contracts once I had a need, and I still haven't had a need come through. But I know a lot of the perception is that providers kind of get the raw end of the deal on subsidy. And so I think it's important, if changes have been made, then informing the providers of what changes have been made and how it's going to solve some of the tricky situations that they've encountered before.
Thanks, Emily, and we appreciate you joining us today. We are really glad to have you here. Michelle and Megan, do you have any, or anybody on the panel, do we have any ideas for ways that we might be able to communicate out effectively? Hey, we know it's hard to break through. There's a lot going on right now, but if you participated in the Childcare Assistance Program 2 years ago, things have changed since then. Go ahead, Kelly.
Well, one of the things I think that we're trying to strategize at Childcare of Kansas and just across the CCNR network too is how to reach providers that are coming into the profession, and have that be like a normalized part of the things that you consider or build into your business model as you're starting up. So, I think we've got opportunities with several of the touch points that providers come into contact with as they're entering the profession, and then supporting them kind of through that process. So I don't know that I have magic answers, but we've been discussing and brainstorming that as a network for how we frame that, how we support providers, and have a consistent approach across all of the technical assistance models that we provide, whether it's program administration support or a childcare health consultant services, or even as we're updating their profile information in our work life systems, asking again, hey, are you accepting subsidy, or can I refer you to someone who can help you if you are interested? And so just every opportunity to weave that throughout our touch points with providers, I think, is something that we're brainstorming about. But it would also be helpful, I think, even for those of us working in the childcare system as intermediaries, as nonprofits or supporting professionals, to have a refresh on subsidy and what the changes are, and work, I think, with DCF on how we best frame that message and how can we partner and support in a really strategic and integrated way too. So if there's an opportunity for that, I think our teams have kind of expressed that at least we've talked about in the CCRNR network. So I'll stop there.
Thanks, Kelly. Megan?
Well, to piggyback off of that, that is one of the things that we have within our marketing portfolio with Mammoth is to sort of, again, strategize and work with our partners too around how can we best promote those changes? How can we, as part of our recruitment and retention campaign, that being sort of a sub goal of that for how can we not only recruit new providers or workforce to the field, but also how can we recruit new DCF providers? And part of that is, I think, what you all are talking about exactly. What are those changes? What are those updates? What does that process even look like for new providers? And I think obviously we'll need the help of our partners in that. I'm looking at you, Kelly, where how those who work directly with providers day to day, how can we best do that? And so I will say, as part of our goals with Mammoth, that is on sort of the docket. And so it's sort of a TBD, but that's where we're actually beginning to phase into or transition into now is what are all the goals within the recruitment and retention campaign. And several of you on the call today, we all met yesterday as sort of that first sort of think tank, and we plan on meeting again and also looking at who else do we need to bring into the fold, how can we get providers involved, and all of those different things. So I'm really excited to see what we can kind of gain out of that process as well.
Thanks, Megan. Amy?
Hi, this is Amy Gottchammer. I was just going to say, as a provider, the one place that I always come in contact with it is on Claris when I do my annual licensing renewal. And we've always taken DCF at Google's, and so I always routinely go through the yes, I will accept DCF part of the application. But I may be wrong in this, but I don't recall seeing anything in there that kind of says, click here for more information. Maybe there's something that can be done in Claris that can, add to that marketing piece for you. Maybe there's a little, hot link or something that can be done there to help people feel more comfortable with making that decision. That's my only piece of information to add. Thanks.
Thanks, Amy. I'm looking to Megan and to Michelle. Do we have any other questions for this group today or asks for them moving forward?
I don't believe that we do today. If anyone has any questions or thoughts that they want to share, I can drop my email into, well, I don't know that I can drop my email into the chat, but somebody can drop my email into the chat to follow up. I know that there's several things that we're working on right now. Like Megan just said, we did convene a small group yesterday. Well, it was a relatively large group for us to discuss recruitment and retention efforts and campaigns and things like that. So certainly as things come up, we will tap this group for help and support. And we just, again, appreciate everyone's time this morning.
Terrific. Thanks so much. And for those who are listening along on YouTube, Michelle's email is Michelle, MICHELLE .Allen, ALLEN at ks.gov. Almost got that part at the end wrong. Terrific. Well, thanks everybody. Let's give a virtual round of applause for a lot of terrific information and the hard work that so many people on this screen are doing to make this happen. I mean, I wrote it down. I know I've heard it before, but Michelle, when you said that we've gotten over $265 million out the door directly into providers' pockets and bank accounts and hands, I know that translates to real things for real people. So that was not the most eloquent, but I'm really excited about it. Thank you. And that leads us really nicely into the close of our meeting for today. So I will open it up for any panel member who would like to share any bright spots that you have that you would like to highlight for the rest of the group. Lucas, I see you come off mute. Go ahead. It's good to see you.
Yeah, sorry that I had my video on there. I'm fighting a cold, and anyway, for those that noticed. We have our open house Sunday, and we're thrilled to invite folks in to see what the facility that we've built here in Lindsborg from 3 to 7 p.m. on Sunday. And so if you don't have details on that and want them, childcareforlindsborg.org would be a good place to find those. Thanks.
Terrific. Congratulations, Lucas. Have a fantastic open house on Sunday. Cassandra.
Thanks, Amanda. There is a documentary that is, the world premiere is actually this next week. It starts today. But we will be having a Kansas showing for 3 days in June. I have been working with the producers of the documentary, but the documentary shows the life of a family with a child with severe medical complexities and how caring for a child with medical complexities affects a family and how it just the stress that it adds to a family. And so I've been working with KDHE and the DD Council and have the funding. And so we're going to have a 3-day time frame to view it. I'm going to be sending out invitations to a set of people in Topeka and hopefully have a showing for those set people with a panel discussion on Thursday evening, the 16th. And then there will be an opportunity for individuals across the state to view it over those 3 days and share it with their families and friends and coworkers and employers, just so that we can get the word out about what our special needs families go through on a daily basis. So look for more information on that coming in the next week or two. And I hope you can, it's about a 45-minute documentary, but I hope you can take the time to watch it. It was fabulous. I have seen it in its entirety, and it really depicts what our families go through on a daily basis.
That sounds incredible, Cassandra. Thanks for sharing. That's June 16th, 17th, and 18th. Terrific.
Yes.
Natalie.
Good morning.
Good morning.
We got some good news from our KSDE Child Nutrition and Wellness team that the free summer meals program is going to be able to happen again this summer. You can contact, there's no application or registration needed. You just have to stop by and enjoy a free meal. To find sites near you, you can visit www.kn-eat.org. And the summer food service program will locate a site near you. Or you can text food or comida to 304-304.
304-304. That's really easy. Thanks, Natalie, for sharing. That's exciting. Esther, go ahead.
Yeah, I just wanted to share. I think it's always exciting when a need is going to be met that we haven't been able to meet in the past for children and families. And Lawrence Public Schools wrote last year for using some ESSER 3 funds for pre-K for classified staff. And we all know there's a shortage of paraprofessionals, teaching assistants, and other classified staff in school districts. So we'll be opening 2 classrooms this coming fall for employees who are classified staff in the district, but will be, even though the funding will not be coming from Department of Education pre-K, we'll be following all the curriculum guidelines, all of the agreements that we've made, and these classrooms will run just as those classrooms do. So we're really excited about that. And I'm sharing this ahead of the superintendent. He's going to announce that at our district board meeting Monday, but I thought it's exciting. Yeah.
Thanks for sharing, Esther. I will not tweet, but I'll be very excited for you. Wonderful. Any other bright spots to share today, panel members? Well, then I will quickly scramble to pull up our upcoming meetings, which are all via Zoom. I would remind everybody that the Kansas Children's Cabinet and Trust Fund meets on Friday, June 3rd. So you can tune in via the Children's Cabinet YouTube. You can find that by going to kschildrenscabinet.org. They'll be meeting from 9 a.m. to noon, and then the Early Childhood Stakeholders Group will be meeting in the afternoon. As a reminder, that's a group that is open to anybody in the state who would like to share their voice and get engaged and join the conversation. To be able to be part of our All In for Kansas Kids strategic planning. So again, you can visit kschildrenscabinet.org if you would like to get signed up for our weekly emails and see the way that you can sign up for those. And then our next early childhood recommendations panel meeting is Friday, June 17th via Zoom at 9 a.m. Esther, did you re-raise your hand?
No, I forgot to lower my hand. Sorry about that.
No worries at all. When I started sharing my screen, it made everything change. And so I just wanted to make sure that I didn't cut you off. Terrific. Well, panel members, thanks so much. I hope that you all enjoy a really peaceful and relaxing weekend and the rest of your Friday, and a wonderful end to the school year. For those of you who are wrapping up the school year, it's wonderful to see you all. I so appreciate the chance to get to visit with y'all this morning, and I'm looking forward to seeing you again soon. Take care, everybody.